right, back to it now. As I was telling you, the jobs report is coming out Friday. And the estimation is 125,000 new jobs, which is a slowing of the economy. But the jobs reports have defied gravity the last few months, so we'll see. It's been better than expected a few times. We were talking about gas prices in the break. Gas around Michigan, $2.80. Inflation down to just over 2% now. Some positive things out there. But it's the surge of healthcare costs that really prevents a lot of businesses from taking the next step and getting the employees they need sometimes. That, according to my next guest, Brian Calley, former lieutenant governor and the president now and CEO of the Small Business Association of Michigan. Brian, nice to see you again.
Hey, Steve. Thanks. It's great to have be with you again.
So, look, I think all businesses battle with this. It's an odd arrangement. It's an American arrangement, this whole get your job, get insurance to go with it. It's not something that's normal around the world, but it's what became normal here because it was a way for businesses to offer an incentive to an employee without having to pay taxes. That's what it was. But now we're in a situation where it's really expensive. Look, insurance is expensive. And I think it's kind of blunting some job growth. In fact, that's what you say here, isn't it?
It's the biggest issue that we really don't hear anybody talking about anymore. And Steve, it's different than the normal thing where people just complain about it and then they suck it up and pay it. What employers are telling us now is that it's coming at the expense of them being able to hire or make additional investments, and not just a little bit, a lot. The employers, 3 out of 4 employers are saying, look, I can't hire new people because healthcare costs are so much. And there's a whole bunch of other costs that have been going up over the last 3 or 4 years too. And it's a pile-on effect. But 4 out of 5 businesses are telling us, small businesses are telling us they can't expand otherwise either. They can't hire, they can't expand. So when you start looking at our unemployment rate creeping up in Michigan, now the second highest in the country, you see softer jobs reports. This is the biggest issue that nobody's talking about.
You know, you did a survey of 300 small business owners, and their concerns are about. So, Brian, we're 16 years on from the Affordable Care Act, aren't we? Aren't we 16 years after Obamacare now? Something like that. 15, 16 years. It was supposed to make insurance achievable, affordable. Hasn't worked, has it?
Unfortunately, it hasn't. In fact, for small business owners, they're really the last ones left holding the bag. So they can't buy the subsidized products on the exchange, and also they can't self-insure like the big players do, the bigger businesses.
Sure.
And so the small businesses are the ones that just have to buy it off the rack, and really they're subsidizing the whole system right now.
Yeah, and you know, this is something we face because every year we get a notice. We have insurance here a little bit. And every year we get a notification. Oh, it's going up 20%, 40%, 50%. Every year, Brian. Okay. You've lived in the world of politicians, obviously. You're a lieutenant governor here in Michigan and had a career in politics before then. How do we ever get this under control? How do we ever make it so insurance is affordable and available? Because everything that seems to be tried fails. And it's failing the small businesses of Michigan today.
You see, in so many different areas, you have the pharmaceuticals that are growing their costs 5 times inflation. The health systems now are buying up they're buying up the whole supply chain, so they have more pricing power now. They're growing their costs about twice the rate of inflation. So all these giants in the system keep on taking and taking and taking, and the small business owner is the last one that is just left standing there, and their only role is paying the bill. So we really do need more accountability. Those systems, those giant conglomerate systems, they're the only ones who can control their costs. But right now, there's not real accountability there.
Right. So, I mean, some of the things have been looked at by the administration in Washington now, which is to make these hospital systems and so forth publish their prices. You know, and when you look at insurance pricing and you find literally 100 different prices for the same procedure, I mean, an MRI costs whatever an MRI costs, you would think. And yet there are all these different pricing. You go to, if you have, like you say, one of the big companies, your rate is this. If you're a small company, your rate is this. If you're an individual that has no insurance at all, your rate is this. Well, doesn't a hamburger cost what a hamburger costs? I mean, that's a crazy idea, but I mean, come on. How can there be 100 different prices or more for a single procedure?
Yeah, and that's because they're using some areas or some payers to subsidize other payers, and that's really where I think there's a big problem. There's also shenanigans with health systems that own insurance companies, and they can manipulate the medical loss ratio in order to get more. There's so many different aspects of this. We definitely need more transparency in the system, but also we should be paying for health. I mean, paying for outcomes. That's really the difference between this system and pretty much every other service that we buy is that it's just a fee for service that is operates on an acute basis as opposed to paying for health, value-based systems. And that's we need to at least start taking some movement toward it because it is absolutely unsustainable.
Yeah, it is unsustainable. Look, um, small businesses employ more than anybody else, right? They're the
That's right.
backbone of the American economy, the Michigan economy, the economy in general. And yet, for some reason, politicians continue to side with the big companies. I know why. Big companies have these things called lobbyists, and they also have this thing called cash where they can put money into campaigns. I mean, you've been around, you get it. The small businesses, even the Small Business Association, doesn't have the ability to lay down the money and have the kind of lobbyists that these big folks do. But how do we correct the system? How do we make it better?
We really do need people who own small businesses that provide over half the jobs here in Michigan and across the country to stand up and say enough is enough because you're right. Anyone on their own really can't make that big a difference in the direction that this thing is going. But you put them all together, and they are by far the largest employer in the country, in our state, in every single community across our state. Really, small businesses are the key to the economy, and we can't take them for granted. These rising healthcare costs and no real accountability and no serious effort to control those costs, it puts our jobs, our economy, and our small business owners at risk.
Yeah, it sure does. If people want to know more about the SBAM, would like to be a member of your association, how do they find you?
SBAM.org, SBAM as we say, SBAM.org is the best way to find us. And we would love to, we have 33,000 members, but there are over 350,000 employer businesses in Michigan. Get this, Steve, there's actually there's about 700,000, maybe even 800,000 sole proprietors and independent contractors, which is it's the most exciting thing that we have going in the small business community right now. How many people are going off on their own and in starting new businesses or operating a small business on the side of their W-2 job?
Right?
Really exciting times with the gig economy and sole proprietors if the government doesn't screw it up with more strict independent contractor rules.
Right, and let the independent contractors have a shot at having insurance for themselves or whoever else might be around. Brian, always appreciate seeing you, sir. Thank you.
Thanks. Great to be with you again.
All right, so if you want to know more about the Small Business Association of Michigan, SBAM, look it up. They're a great resource for small companies, even sole proprietorships, and companies under 50 people, of course. We'll be right back.